Lights low, city glow, truth in the air. Conversations heavy, but we handle with care. From love to the culture, the power and pain.
There we go. Good evening, everyone. Good evening. Good evening. You are tuned in for a special Java After Dark through our partnership with Action for Boston Community Development, also known as ABCD. This isn't my regular hat, so I'm trying to make it work. Okay, there we go. I have to shout out Jamie and the team over at ABCD for making sure I have a little bit of swag today. But we're here to talk about a serious subject. Again, welcoming you into the Java Cafe, and also asking you to be sure to share this episode. There is some very important information that we need to share with you. So much so that when I posted the flyer today, one of our guests, Sister Jenny, posted, "Oh, I thought syphilis was something from the 60s and the 70s. Syphilis is on the rise." And so, with summer coming and everybody getting their wonderful bodies and summer bodies and things together, remember we had cuffing season, don't get burned. No, cuffing season, cuff safely. Summer of Love, which is returning this year. We had that last year where we said summer of safety, but don't get burned. And so syphilis is on the rise. And through our partnership, we've been making you aware for months, almost years now, about the 3 kiosks that are available throughout the city of Boston. One is at 575 Warren Street in Roxbury, 110 Claiborne Street in Dorchester. And I'm going to bring in my Java After Dark, your healthy co-host, Maureen, to remind me of what is the Parker Street address?
The Parker Street, I think, is it 714?
That's what. Okay.
Claiborne.
I think I said 774 this morning. Man.
Yeah, it's at Claiborne and Park Street.
Okay. So right there in that area as well. And so Maureen and I have been talking about the kiosks. So those are available to you. We were getting ready. Maureen, I think you said there's rapid testing now.
Yeah, there's syphilis testing and HIV testing added.
Okay.
And slowly people are figuring it out and they're starting to dispense, getting that product dispensed. So that's good.
Absolutely. And so, Maureen, though you're a co-host, I still want to give you the opportunity. Maureen, welcome to Java After Dark.
Thank you for having us again.
Absolutely.
I'm Maureen Scott. I'm the Director of Health Services at ABCD. And I'm a women's health nurse practitioner. So I've dealt with diagnosing, treating STIs for a very long part of my career. So I'm really excited about sharing this information because we're going to be talking about syphilis. It's an infectious disease, and many people think that it's disappeared or it just doesn't happen that often. And surely the people that have it don't really like to share that. No one likes to share they have an STI, but especially syphilis. It's increasing across the United States. The numbers are going up in Massachusetts. It's a preventable, detectable, it's a treatable disease, infection, yet we're seeing the infection rising. Why? Why is it surpassing the other infections? It's a question. It's also congenital syphilis, which is syphilis that affects newborns, affects babies. Those numbers are also going up. So the conversation tonight is about education, awareness, reducing the stigma, encouraging testing and treatment. So joining us this evening are experts in infectious disease, sexual health, adolescent, maternal health, and public health. They will help us understand what syphilis is, why the rates are rising, how it affects pregnancy, babies, and what the communities can do to protect themselves. So thank you all for being here. And I'd like to start by introducing Florence Okonkwo. Florence has a Master's of Science in Nursing. She's a dedicated, experienced family nurse practitioner with over 4 years experience in primary care, infectious disease prevention, pediatric, adult, and geriatric care. Patient education, prevention, early intervention, and sexual transmitted disease prevention is her experience. She currently works at the Codman Square Health Center in the Communicable Disease Prevention Program, which also is in, she works in the X Clinic. Many of you heard of the X Clinic. We talk about it a lot, where you can get STI testing. Her experience in various settings has impacted her holistic and compassionate patient care and enhanced her commitment to serving different populations. She is passionate about community health, disease prevention, and patient empowerment through education and culturally sensitive care. Outside of her work, she's a loving wife and mother of 3 who likes to cook and to sing. We won't ask you to sing tonight. Also here this evening is Dr. Arij Hassan. Dr. Hassan is a physician, Master's Public Health, is attending in the Division of Adolescent Young Adult Medicine at Children's Hospital and is an assistant professor of pediatrics at Harvard Medical School. She completed her residency training in pediatrics at Hasbro Children's Hospital, Brown University, before her fellowship in adolescent medicine at Boston Children's Hospital. In addition to primary care, Dr. Hassan focuses her clinical interests on sexual and reproductive health and reproductive endocrinology and is co-director of the long-acting reversible contraceptive program. Do they call that like by LCAR or something? She is also the medical director for the Metro region of the Department of Youth Services, overseeing a team providing comprehensive care for youth in the system. Outside of clinical care, Dr. Hassan maintains an active role in global health and directs global activities for the Adolescent Medicine Division. She currently teaches, consults, and is involved in pediatric health. And lastly is Susan Fitzgerald. Susan is an RN with a Master's of Science in Nursing. She's a certified pediatric nurse practitioner. She's the program director at Boston HIV Adolescent Provider and Peer Education Network for Services, also known as Boston Happens. She's associate director of Adolescent Primary Care, Division of Adolescent Young Adult Medicine. And welcome, ladies, and thank you for being here this evening.
Maureen, thank you. As our co-host Maureen comes in, she gives us an introduction, and then she goes on her way looking at stats, data, and getting stuff together for the Health Services Department. Yeah. So Maureen, thank you for being with us as always. And next month, we are going to come back on the 3rd Thursday as well. And so
men's health. We're focusing on men's health with male physicians.
That is awesome. Maureen, thank you. And we'll see you next month. Thank you so much.
Right. Bye-bye.
Everyone, welcome to the Java Cafe. Thank you all for being here on a Thursday evening. It is definitely important for you all to be here this morning. And I'm so used to saying this morning, this evening. And so very quickly, because Maureen read your bios, I'm going to ask you to greet the audience, each of you, and then we're going to come back to focusing on what syphilis is, how do we prevent it, how do we treat it, and then if it goes untreated, what are some of the risks that are at risk for the patient, and then also expectant mothers. We're going to talk about that as well. And so I am going to start in this order of who's on my screen, as far as if you could say hello to the audience this evening, and in your work and practice, if you could give us one word for the rise, or give us one word according to what you're seeing in the context of syphilis. And Doctor, now say it for me. I heard Maureen say it. Dr. Oko. Actually, yes, please say Florence. Nurse, I'll go ahead and say Nurse Florence. Nurse Florence. That is very interesting, as in Nightingale. Please go ahead and say hello and give us one word for syphilis.
Hi, everyone. Good evening, everyone. Thank you, Jimmy, for having me here. My name is Florence Okonkwo, one of the nurse practitioners at Codman Square Health Center. I have been a nurse for 12 years, as Maureen read, and I've spent my last 4 years as a family nurse practitioner in X clinic. I spent most of my time taking care of primary care patients in adults and also in pediatrics. And I spent a little bit of time in S clinic, where we provide preventive sexual health and testing.
And what's
To
your one
adult
word for
uses.
syphilis in doing that? That one word.
So one word for syphilis is something that is testable. That is, it can be tested, it can be diagnosed, it can be treated.
So testable
Yes,
is your word. Okay. All right.
exactly.
Thank you so much, Nurse
Thank
Florence.
you.
Arij, we're going to come right. Actually, Susan, we're going to come right to you and ask you to greet the audience. And by your practice, also, or your experience in your practice, give us one word for syphilis as well.
Great. Thanks for having me. I would say the one word is sneaky. And I think because we don't do a great job in education, and I think we miss the diagnosis a lot. And we haven't done a great job in empowering people to know more about it and to know what questions to ask when they have concerns that they might have been exposed.
So we have testable, and Susan said sneak. Oh, there's so many implications there with sneaky.
I know. That's right.
Dr. Arij, if you could also greet the audience and give one word from your experience being in community, working to prevent and also treat syphilis as well.
Yeah, thanks for having me. I'm Arij Hassan. And I work with Sue in an adolescent and young adult clinic, seeing patients aged 10 to 25, 26. I think my one word would be disappointing, disappointing because this is something that should not be happening. And a lot of it has come from cuts in public health and not making it a priority. And this is something that we can absolutely treat and bring the numbers down. So it's disappointing to see the numbers heading in the wrong direction.
Okay, so we have the three words. We have testable, sneaky, and you said disappointing.
Yeah.
Okay, and we're going to get context on that. And so, Arij, if you could share with us, like what, and again, to the comment that my sister shared earlier, I remember growing up and hearing about syphilis. And back in the day, someone has a little echo in the background. Back in the day when they would say ED, then we went to STDs, and then we went to now STIs. And so, Arij, if you could tell us, what is syphilis?
Yeah. So syphilis is, unfortunately, I think it's a cruel disease if it's not picked up early, but it is a sexually transmitted infection. It's caused by a bacteria. The fancy name of the bacteria is Treponema pallidum. It's something that can replicate really rapidly within your body once it's picked up. It can infect anyone. So any age, young, old, any gender, any race, any sexual orientation, any area of the country, actually any area of the world. And it is, in many people still refer to it as what's called the great imitator, because it can seem like any viral illness initially. We often think people have the flu when they initially come down with symptoms with it, because it can look like any other viral illness initially. It is curable, as has been mentioned, which is why it's so important to test and treat early. If it is not treated, the consequences can be devastating. It can cause complications in almost every organ system. So your brain, your heart, your nervous system, your vision, your hearing, and it can impact women who are pregnant and lead to consequences for the baby.
And also, I wanted to check in with you and ask, and thank you for raising that, like our familiarity with it and what Susan said, like it's sneaky. You said it can mask itself rather to look like flu, similar to like HIV in some cases. And so give us a little bit of the history. You know, it's a bacterial disease. It replicates itself. very fast. What is the history of syphilis? And if you could somewhere, by just your knowledge, where did the drop happen and now, we have the rise? And maybe to Susan's point, maybe because it's the lack of education. Reed, if you could finish that part, and then we're also going to talk about one type of syphilis with Florence as well, is congenital syphilis.
So syphilis has been around for centuries. The initial cases were first picked up in the 1400s. So it's been centuries and centuries of syphilis being around. Prior to, in the earlier years, when it led to terrible consequences and high rates of death. The turning point came with the development of antibiotics. And so that happened in the 1940s, 1950s. We got penicillin for the first time. And that really was the game changer because it can cure syphilis. And so that was when we saw rates declining over the next couple of years and the next couple of decades. We actually reached an all-time low in 1999. There was a point where we actually thought we could get rid of syphilis entirely. And then now rates have been picking up. There's probably many reasons for that. In large part, I think in the 1990s, there was a lot of scare around HIV, and HIV being a disease that was at that point known to kill people. And that has shifted now through the years, where we know that now HIV has become more of a chronic disease. And now with PrEP and other interventions, I think people aren't necessarily as nervous anymore. And so that has likely also kind of contributed to decreased condom use and increased rates as well.
Also, as you mentioned the rates, if I could just ask you real quick, do you have any data specifically on Massachusetts or Boston? What are the rates when you reference, a rise in rates? Do we have any numbers? We know that they're rising, but if you have any, what info do you have?
Yeah, so in every part of the country, they've gone up. In Massachusetts, in the past year, there were over 800 cases of primary and secondary syphilis that were noted. And for congenital, which we had gotten down to very, very low rates, there were 18 new cases, which is a 29% increase over the last 2 to 3 years. We know that urban areas, so Boston has higher rates of STIs and syphilis than some of the more suburban kind of rural areas. And then we know that the highest rates of infection, not surprisingly, are usually in young adults. So the population that I see, which is true of all sexually transmitted infections, there's more exposure, so not surprisingly higher rates. Also higher rates in those who are not able to access healthcare and not be able to get screening and treated early. And that also applies to pregnant women who don't have access to prenatal care.
We're going to talk more about that, and specifically beginning in Florence and Susan. Thank you both for your patience. Florence, can you reach reference to primary and secondary, and then congenital syphilis, and to hear her say that we got to a point that we thought we would abolish it and it's gone. And Arish, you kind of talked to, healthcare disparities and inequities in healthcare. And so we won't, go down that road. We talk about that here often. And so Florence, can you give us an overview of what is congenital syphilis? Now, from my time as a family planner, trained, took the classes at ABCD. Congenital has to do with your sexual area, correct?
Yes. So
parts. I said area. I'm trying to be, it's after dark. I'm trying to be sensitive. My mother's in here watching. So.
Awesome.
Okay. Florence, go ahead. Please let us know what congenital syphilis is.
So congenital syphilis is when a pregnant woman who unfortunately is infected with syphilis, got pregnant, and probably maybe due to lack of early prenatal care or screening, they end up giving it to their baby. So the baby can get that infection at any stage of pregnancy, at any stage. So that's why it's very important for the pregnant women to be screened they screen them at the entrance of prenatal care and also at 28 weeks of pregnancy and also towards the end of pregnancy. So that's a lot of, because when a fetus or a child or unborn baby is infected with syphilis, it affects a lot of things, including their development, and can equally result to stillbirth.
I think we got a little bit of a, I love tech. We got a little bit of a freeze. Arija, I see you was getting ready to jump in there. Florence,
Yeah,
we got
back.
you back. You froze
Yeah,
a little
sorry,
bit. Okay.
my computer just turned off. I'm
It's
so
tech.
sorry.
Listen, we're fine.
So I don't know where I stopped, but so I said that congenital syphilis is what happens during pregnancy when a pregnant woman who is infected with syphilis passes it to their unborn child. And it can happen at any stage of pregnancy. That's why it's important for any pregnant woman to start prenatal care on time. And at the entrance of their prenatal care, they are screened. And during at 28 weeks of pregnancy, they're also screened towards the end of the pregnancy. They also screen for syphilis because it has a very bad effect on the outcome of the pregnancy, including causing stillbirth and also causing like preterm birth, and affecting a lot of things in the baby and baby's development. So it's entirely treatable. So it's important for pregnant women to be screened. And
absolutely. And you
yes.
may I ask you also this? Do you have any data in reference to? And thank you for the clarity, because I it's been a while since I've been out of direct care with adolescent in an adolescent clinic. So congenital syphilis has to do with a woman who was pregnant and passing it to her child. That is congenital syphilis. Thank you so much for that. With it being almost a separate category, are the numbers very different? Are they, where are the numbers with congenital syphilis, especially with the rise that we're referring to?
Yes, so recently there has been an increase in congenital syphilis in the United States. Just 2024 alone, there is nearly about 4,000 congenital syphilis cases reported in the United States. And it has continued to increase. Even in Massachusetts, just from 2023 to 2024, it just about 18. A big jump from, I think, 4 to 18 cases reported. And in that 18, they have like 2 intrauterine deaths and stillbirth, and also about 2 neonatal deaths. So the number has been increasing lately.
So here's an alarm, a red flag that just raised for me. A lot of times when you hear about STIs, you think about the adolescents, the adults, the people that are sexually active. To hear you say that there have been 2 uterine births due to syphilis, when you say it's testable, it's important to, you know, when you go in and get your UCG, is it UCG? Your pregnancy test?
Yes.
It's important to be tested, you know, for all type of STIs. And so to your point earlier, when you said it was testable, it's alarming, because I would presume that if there was a early diagnosis in the first trimester or whatever, I would presume that there wouldn't be those uterine deaths. Am I correct?
Exactly. Yes. Exactly.
So I'll be honest. I shared with our team at ABCD. I said, we got, you know, women in here, and can we get, you know, a man to talk about this as well? But I think that I'm a little more, and we got to make sure our men get the information. But hearing that happened, I'm fine with us informing women and men who are fathers as well that you want to be knowledgeable about your sexual health, and then also your partners, because you don't want to go through 6, 3, 9 months. Okay, that I told you all we would, you know, focus on the data that we want to share, but that piece of information just kind of alarmed me a little bit. And so we know about uterine death. It can cause, so if it can do that, it can do things like miscarriage, birth defects.
Yes. Low birth weight. Yes.
Okay. All right.
Blindness. Yeah. A lot of developmental issues.
Okay. So we know that there's primary syphilis and secondary syphilis. And the reason we come back to you, or Susan, as you're getting ready to talk with us, And then there's congenital syphilis. And that is the one that, while the adult should have responsibility to take care of themselves, you now are potentially passing that. You're having your child come out with not a, there's already enough inequities in the world. It's testable. Susan, it's testable. Yeah. And you said
sneaky.
There we go. Let's and then Arish said disappointing. And so Susan, what are the stages? We talked about it being testable. Arish said that you can present sometimes with flu type symptoms. So what are the stages after, transmission or when you receive a diagnosis, a positive?
Well, it kind of depends. So you can get it, and it can take anywhere from maybe 10 days to 3 months. And usually you get what they call a chancre, which is a small sore. And you get it at the site where the syphilis sort of entered your body. So it can be around your bottom, it can be on your penis, around your vagina, it can be in your mouth. And they can be really large or they can be really small, so you can miss it because it doesn't hurt. And that's the key to it. It's painless. So you get this little sore and you kind of get worried about it, and then it goes away. And for a lot of people, that's it. That is their sort of exposure. And you can miss it. A lot of times it's picked up, it sounds kind of funny, by your dentist, because people say, I got something in there that's bothering me. And because you can't see it as well. Or it's just a really small one somewhere in your genital area and it doesn't hurt, so people don't notice it. And that little sore can last anywhere from maybe 3 to 6 weeks. And then it just goes away. And so people are like, I'm good, whatever it was, it's gone. I don't have to worry about it. And so they don't do anything about it. Or they tell their provider and their provider's like, well, I don't see anything, so it's probably okay. And then after that little sore, or chancre is what we call it, appears, anywhere from maybe 1 to 6 months later, you can get a rash. And what's interesting on the rash is it really shows up on the palms of your hands. It's like this reddish brown rash, and you can't miss it. And it's also on your feet. It can be anywhere on your body, but specifically hands and feet. But it doesn't itch. And you can be a little more tired. As Dr. Hassan was saying, you can kind of have flu-like symptoms. You can lose a little bit of hair. You can have swollen lymph nodes, and then it just goes away. Again, this is no treatment. So this is why we're saying it's sneaky, because you can notice it or not, and then it goes away. And then there's nothing. They call it the latent stage. Then there's nothing. No symptoms, no rash, no chancre, no anything. And you feel just fine. And that can go on for a long time. And then you kind of go into this like tertiary stage, this third stage. And that can be anywhere from like 10 to 30 or 40 years later that you've been walking around with this. And now during any of these times, it's still transmissible. So you can give it if you're pregnant.
That was my question.
Yeah. You have.
I know the answer, but I had to. You're walking.
That's it. You can.
Go ahead, Susan. I'm sorry.
No, you're right. You're right on. And the bad part about it is this bacteria sort of sitting inside you also makes you more susceptible to other STIs, especially HIV, when you've got that open chancre. So it puts you at more risk than you want to be. And so after we finally maybe pick it up, like decades later, at that point, you can have all kinds of multi-system issues, like Arish was saying. You can have changes to your mental status, including dementia. You can get heart damage and problems with your valves. You can lose your vision. it can spread into your brain. So it crosses, usually when we get an infection, it stays in your bloodstream. It doesn't cross over into your brain. This can. You can get hearing loss. And then we sort of, when you're complaining about this, do a little bit more workup. And even still, syphilis doesn't always rise to, let me test you for syphilis with that. We start looking for other causes. So that's why I say it's so sneaky.
Your word is definitely on point. And as you're sitting here talking, you name some things that kind of demonstrate themselves in our senior
That's right.
population.
That's right.
The thing that with inequities in healthcare, or for various reasons, people didn't know when they were 20, 10, 30 years ago, some of what's demonstrating as and to your point, that a physician would not think, because since they've had the patient 15, 20 years,
right,
they're married, there's sexual activity, they haven't demonstrated any, so there's been no reason to screen or test. And so the doctor's not going to think, oh, you're having vision problems, you're a little foggy in the brain, you're displaying signs of dementia. No one's going to think about, oh, we need to test you for syphilis.
Yeah. The other thing is at some point in your adult life, people stop asking about your sexual activity.
You mean as providers?
Yeah, they do. It's like, I don't know about any of your listeners out there, but it's like, you hit 40 and everybody just assumes that you're doing your thing with maybe the same partner for the last 20 years. Nobody asks. So they don't even, we're not even talking about HIV or
no. Here, let me tell you something. Yeah. Here we are, thanks to our partnership with ABCD. Yeah. We've been raising with the seniors. Yeah. We've been joking, talking about the seniors, talking about what just because there's snow on the roof don't mean that the fireplace isn't burning or something.
But you know what? Nobody's asking whether that fireplace is lit.
Susan,
okay. But it's true. And so we don't ask those questions. And this is why it gets so sneaky. And this is why congenital, for a long time, we didn't think that women were really susceptible to syphilis. And what's interesting is we used to test for syphilis when you got a marriage certificate. We don't anymore. And a lot of people don't go that route anymore. So they don't ever get tested.
All right. I want to be cognizant of time too. Susan, I told you all in the beginning, this could go a whole different way. I'm just realizing, and one of the things I want to say, if you're a caregiver of an elder and all of a sudden there's this new onset of something, and if you go to physician with them, and you might have to, nudge grandma and say, Grandma, I was watching Java with Jimmy the other night, and they for some reason can't find anything wrong. Back in the day,
that's right.
I got a couple of other cousins over there that's not any of grandpa's. I'm messing. I want to, because this is such a serious topic for our elders and for our young people. And then for, unfortunately, someone that may go not tested, not understand the sneakiness through a disappointment of giving congenital, making your child have congenital syphilis, or we need to make sure that our caregivers, our young adults, and our seniors are aware that some of the what we generally just accept as an aging, part of our aging, that we're going to now have to start asking, back in the day, well, Susan, these days, because what you said, the fire is still active, it could be 3 weeks ago. But I mean, in what we call similar to long COVID, there's I'm sorry, Florence.
Yes.
We've talked about the stages. And so now let's get ready to talk about, let's say you got tested, you realize the sneakiness of it, you're disappointed by a diagnosis. And okay, now what is the treatment? What can be done? And I would ask you, based on what Susan said, if there is what is in the intermediary, the immediate, and then are there, and I don't know if it's you or Susan, that would talk to, do you treat a delayed diagnosis? Let's say 25 years in, you do the test because you can't figure out what's wrong with grandma. is it the same treatment? So if you can you talk about immediate treatment, and then based on what Susan said, and now we're thinking about our elders, is the treatment the same once you get, if you've had it before? Is
Yes. Yeah. Penicillin is the game changer. Like Dr.
penicillin still? Oh, sorry. Penicillin still works out here. Sorry. Go ahead.
Yes. So, there has been a lot of deaths before penicillin was discovered. So since penicillin is now used to treat syphilis, it's recommended, it's approved for treatments of syphilis, and that has helped in decreasing the rate of infection and survival of those who were infected, unlike in the past. So that's the preferred treatment. But however, there's a national shortage of this medication recently that DPH now prioritize pregnant women because that's the only medication that can effectively treat syphilis in pregnant women. So now we are utilizing other alternatives like doxycycline, and the duration of treatment depends on the stage of the infection when the patient is diagnosed. So each stage, like primary, secondary syphilis, you can use Bicillin, just one injection, that's okay. But if is tertiary, that means that it's latent. So how do you know when it's latent? That means if the person was screened for syphilis in the last 12 months and it was negative, then screened again, now is positive. That's early syphilis. But when there's no record of syphilis screening, maybe the last time it was screened was maybe more than a year ago, then we treat for latent syphilis. And that's the duration of treatment is longer. If you're using Bicillin, we treat for 3 weeks. If you're using doxycycline, you treat for 28 days. And that's so for elders. Sometimes they don't even know like if they have been treated or if they have been diagnosed for that before in the past. So we ask them like, do you remember getting injection, like white something? So by the time, because sometimes they don't know what it is, they don't know what the name syphilis, but when you ask them, describe the kind of injection, they'll say, oh yeah, I remember getting something like that. So so we are, because of the shortage of Bicillin, we are utilizing the alternative for non-pregnant women, but for pregnant women, we only use Bicillin.
So can I ask a clarifying question? When you mentioned the latency diagnosis, that can be up post a year, but that latency diagnosis also includes a year to 10 to 20 years to what Susan was talking about earlier. Is that considered?
Yeah, latent. Yes, it could be more than, as long as there's no screening within the past 1 year, because you cannot determine the duration of that infection in the person's body. I'm sorry.
Well, we need to suggest something to the protocols or whatever, because there's latency and then there's like that 10 to 20 year for our elders is very different.
So
Susan,
another thing, sorry.
go ahead.
So another thing is that at that stage, like for elderly, we assess for neurological symptoms because if it has neurological symptoms, then the treatment is different. So you're not treating with Bicillin, weekly Bicillin for 3 doses. We also send them maybe to have a spinal tap to check for neurosyphilis, and that will require IV penicillin.
Did you say neurosyphilis?
Mm-hmm.
Yes.
Brain infection. Yeah.
Yes.
I know what you Dr. Hassan Arij. I'm getting real comfortable because almost said something. This is so much more than what to the point of sneaky and oh my, this is not good. This is not good, especially within a time when there's so much ambiguity. Patients are watching what's going on within protocols of public health. I'll frame it like that. And okay. I need to come back and bring myself focused. We talked about pregnancy. We talked about the bisacillin. And Susan, I'm going to come back to you, and Dr. Hassan, we're going to have you'll focus on closing us out. But one of the things I want to talk about, and you mentioned this when you said it's sneaky because of lack of education. One of the reasons why we have this partnership with ABCD. One of the reasons why, and I had some things in my mind about the importance of watching tonight. Yes. But oh my, I did not know. Education. Susan, what should we be doing around education?
So I think letting people know, we have to be honest in our sexual health education. Like, here's all the things you can be exposed to. And here's the funny thing. It's a cheap test to do. You can do a blood test that you can get the results back in a day or two. You can do a rapid test that you can get same day results, and it's treatable. And I think we need to stop with the stigma of STIs and say, you know what, we need to empower everyone to feel comfortable about talking about their sexual health, and to say, look, I just want to get tested once a year, because as Florence was saying, if your test was negative last year and positive this year, we know you got it within the past year. It drives our treatment. But, I think it's also, we've got to make this information accurate and easily accessible to people, and stop sort of stereotyping who's going to get syphilis, because in reality, as you just heard, anybody can, from a baby that hasn't arrived yet, to somebody who's going into their late 90s. Doesn't matter.
I cannot imagine. And in my conversation with ABCD Health Services, when we started a couple of years ago, we were kind of, snickering. But the reality is that Maureen, who's a nurse practitioner, like Florence as well, mentioned that she had or wanted, I believe it was her, that she had treated someone in a nursing home.
Yeah.
All three of y'all sat there and said, uh-huh.
Yeah.
Yeah.
Yeah, of course.
Okay.
Yes.
And then Florence said, of course. I mean, with things like Viagra, and I don't know, please tell me, you all, is there a Viagra for women? But with things like with Viagra in older stages and making, people keeping the fire burning in the furnace, as you said, at the same, and the thing that we have to think about is, in their day, it was a little bit different. Things are very different now, and all this stuff. And let me reframe that based on what you said, Susan, because a word like stuff has a very negative connotation, and we want to be intentional about our words. And so things like the density and the types and strains of ST, back then it was VD, may not have been as prevalent. And so they're used to, you telling a 75-year-old he got to put a piece of plastic on before he do something, huh? Oh, this is just, I'm sorry. All right. The number one thing, and I can't believe I'm saying this, I used to work at an abstinence program, and then I kind of understood where people are. But if you all agree, the number one way to prevent this is abstinence. But from a harm reduction reality of where we are, let's talk about prevention. And so Dr. Hassan Arif, interchangeable. Let's talk about prevention after abstinence. What does prevention look like? And then we can kind of free for all the three of you now. But Dr. Hassan, if you could kick us off for after abstinence, what are the ways we can prevent transmission? Away from congenital, because if you go ahead, sorry.
Yeah, no, you're absolutely right. So number one thing, condoms. Use condoms. Use some type of barrier method. And again, condoms are not 100%, because if they don't cover the area of the skin where the chancre is, or where that ulcer is, it's not necessarily going to like protect you, but it still is the number one way to prevent picking up infection. And then I mean, that's really the big take home from all of this, is that everyone can be affected by syphilis, and it is preventable by condom use.
Okay. So condom use is the number one way. Obviously, Susan mentioned a few minutes ago, and I know some people that, you know, aren't as sexually active, and routinely in their routine health exam, they have a full screen run. Let me ask you all as providers, if you ask, is there full, you know, like you say a CBC or UCG, there's a series, there's a test, you know what, the phlebotomist knows what little color thing that, I don't know, I'm being traumatized as I'm pointing to my arm about the phlebotomist, but is there a series that includes everything? If you go into your is there a universal series when you say I want an STI HIV screening, or is it left up to each, you know, well, I've said partners, MGB, DMC, is it left up to the provider? Or when a patient asks for a full sexual screening, what does that look like?
So at a national level, there is not like a one standard recommendation. It is like left, every state is different. Every office within the state is different. It's partly based on like how high the infections are in that area. It's based on providers perceiving risk. From our end, like, so in our clinic, because again, we see a lot of young adults, it's become a standard of care. Like when people come in for their annual exam, even if they are thinking I'm not a person who's high at risk, we kind of phrase it as like, this is something that we do for everyone who's having sex. It's good to know at this point in time that your test is negative. Just as we would check your blood count to make sure you're not anemic, we're going to test you and make sure you have no infections. And it's a good thing to do. So everyone gets an annual exam, and actually can have it repeated even sooner if there's like other concerns that come up. But every practice is a little bit different with that. I will say that syphilis now has become, because in Massachusetts the rates have gone up, it is now recommended that we are including syphilis screening along with gonorrhea and chlamydia and HIV, which maybe like 15, 20 years ago was not the case.
Florence, may I ask you, as we get ready to close out, is there any, you know, you're at the X clinic, presumably there are a lot of adolescents there. My point is a response to Dr. Hassan was similar to teenage pregnancy back in the day. The funding goes in, the testing goes in when you see that there's an alarm. As soon as the numbers start to go down, I want, and you know, some of this is often driven. Some of this is often driven by insurance, the amount that the test costs, and you know, why are we running a syphilis screen on a 65-year-old? Maybe because at 35, sorry. Florence, anything to contribute as we get ready to close out? Did we miss anything? I do want to touch on a little bit, all of you can, that when we talk about untreated syphilis, the number one thing that comes to mind, or the number one, or how we found out the worst of the worst, is through a group of men. And then you all let me know if there were women too, but I primarily know there was a lot of men from the Tuskegee experiment.
Mm-hmm.
And so I see Susan. And so Florence, anything we missed, and then let's any contributions or from that situation, because that's how we know the most extreme of syphilis, because these men and I believe women were left untreated. Florence, go ahead. I'll shut up.
Yeah, so I know. So like community health center, so the population we serve is underserved, and they are faced with several determinants of health issues like insurance, access to care. So we do sometimes have patients that will just walk in without insurance. So we have some services in place that help patients in that situation to be screened. And also sometimes we have patients who are still under their parents' insurance because the screening, the testing, everything is confidential. So there are some services that help them get screened without using their parents' insurance, without their parents knowing that they come for screening or they were, tested for something. So A lot of services are out there to support patients, and the clinic are open 6 days a week. You can walk in. You can also call for appointment.
Okay. Maureen, I know you're commenting. Maureen, if in the comments you can put for us, as Florence was talking about adolescent consent. I know in one of our, I think it was last month's episode, we talked about school-based health centers. I just want to know from Maureen's knowledge if this is part of any screening, if an adolescent walks into, you know, a school-based center. And as I'm talking about it, I think there's some level of written consent generally that maybe parents give at the school-based center. But Maureen, any clarity that you can give to that? Because I'm just flabbergasted.
And I know when we do
Please, Susan.
outreach, yeah, when we do outreach, you can get free STI testing and HIV rapid testing. And so we don't even need your name. We'll just, if you come up to our outreach folks, you can just get it so that there's nothing. But if I can put in one more plug,
Please.
you know, the population that we see for healthcare, especially for teens and young adults, you know, our 12 to 26 range, is really skewed much more towards women. Guys just don't come in for care. And we need to see you. We want you here. We want you to get that information. And somehow it's become the cultural norm that it's like, I'm good. And it's like, but just get screened. Let's get our young men in for care.
And you said 12 to 26. And
Yeah.
Listen, I know yeah. I I remember being a 12-year-old and
Yeah.
oh,
They're not coming in.
so
And-
I hear something from you and Maureen. I don't know if you're still on, but with some other brothers and whatnot, we need to make sure that we get this information to them, because the women are coming in getting screened and whatnot. But this is a very interesting. A portion of the women we know are not contracting syphilis by themselves, and y'all understand what I'm saying there.
Yeah.
And so we need to get the who laughed, Dr. Hassan. It's real, and so that is a warning note for me. And Maureen, Susan did answer, but thank you for contributing. When I worked there, we screened for chlamydia, gonorrhea, and trick. Oh, we haven't heard a trick in. Is that coming back?
Mm-hmm.
Susan, she said. Mm-hmm.
Mm-hmm.
If there were positive for any of these, they were tested for syphilis. Okay. Dr. Hassan, take us home. What we know what it is. We know the history. I'm sure, or presumably in your studies, you learned about Tuskegee. Anything you want to mention on that? We know that we have to get everyone into care, our elders. But what I hear, two populations from you all are elders and young men, specifically all, but we need to focus on our young men and our young men ages 12 to 26 and our elders that may be demonstrating some what we would just consider, what is the term? Illness of age or
Right.
getting older. Sorry, mothers and everybody that's in the Java Cafe over 55. But y'all exhausted me tonight. Dr. Hassan, what did we miss anything? What
Yeah, I think if the couple of key points that if you remember anything from this podcast is that syphilis can be it is 100% treatable. Early testing and early testing saves lives, brings down rates for the community, brings down all these potential consequences in terms of all your organs being impacted. And we should be normalizing having conversations about syphilis, about sexually transmitted infections, reducing stigma, just making it seem like this is like a normal conversation, just as we talk about heart disease and we talk about asthma. This is the same type of conversation that we should be having, and it should be happening across every single age group, young, old, middle-aged, in every community.
All right. I'm done. It's just unbelievable. What I learned and what was reinvigorated learning some years ago. But this is something that Maureen is in here talking about. Yup. This is something that we have to get in front of, because we don't with what's going on. We know one of the social determinants of health sometimes is people's environment, their mental health. You know, if people are dealing with poverty, food deserts, addiction. Yeah. All right. I always try to end on a good note. One of the things, to Dr. Hassan's point, was key takeaways are it is treatable. You have to do early testing. And Susan mentioned that from the kiosks that ABCD has, if you hear about to children's or different programs being out in community, there is a ability to do a confidential, no name rapid test. Now, at some point, they're going to need to track you. And if you're going to get treated, you're going to have to, give up some information. But I think at that point, the diagnosis is it is treatable, to Dr. Hassan's point, but you can't treat what you don't know. And you don't want to be around here 15, 20 years from now wondering why you're blind in one eye, or you're having, and I don't mean to say it like that, but maybe this is part, Susan, to your point, and all of you have said, of having some real conversations. And just, when I was a youth worker, I used a scare tactic. I would tell the young men, you won't come in here one day and sit down and your thing fall off. Harm reduction. All right, I'm getting into commentary. I'm going to get you guys off of here. I really, 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 really appreciate all three of you and what you contributed to. Like, this is on my radar. This is on my radar. And so thank you all very, very much. Please keep me abreast of things going on. I'm sure Maureen will, if you all are doing anything. And just had a health fair, but it looks like I'm going to need to have another one, maybe just for men. And then maybe one that just focuses on STI, HIV prevention and treatment. And we just focus and have those. Actually, we are doing one this summer with ABCD. So don't be surprised if you all get an invite to, table or. Thank you all. Susan, please tell Mo that James Hills from the emergency room back in the day, from the community, said hello.
I sure will.
He was at YPPCCHP.
Yeah.
And I will be at the Borum and doing the church basement.
Oh goodness!
When the HIV epidemic first started. So
Susan, you telling your a little bit of your age now, because that was
29, Jim. 29 plus a couple of anniversaries.
Okay. I seriously appreciate all of you for being here this evening. So please get some rest. I know it's a little bit later, a couple of minutes over, but thank you. Thank you. Thank you. Thank you. Thank you. Thank you. Thank you.
Thank you so much.
Thanks for having us.
Have a good evening, everyone.
Thanks. You too. Bye-bye.
Listen, folks, for those of you that really know me, y'all know I'm sitting up here. I am I'm struggling. Did y'all hear that? If you are a provider for a 65, 70-year-old, doctors are testing them and not finding out what's going on. You now are empowered to say, hey, grandma, hey, auntie, grandpa. All right. We're wrapping up. We will see you. Nisi, it was good to see you on Saturday. We will see you on. I'm going to take Monday. I'm going to take Monday off. Monday's a holiday. We will see you on Tuesday at 10 a.m. Y'all know it ain't often that I'm not with words. That is just, yeah, no. All right. Thank you for being with us this evening, Tuesday at 10 a.m. Everybody, please have a safe weekend. This is the official, kickoff to the summer. City of Boston had their summer safety, all the things that kicks off the summer. Please make sure that you all take care of yourselves. I don't think we're getting another heat wave. So, all right, folks. We'll see you on Tuesday at 10 a.m. Remember, for those remember this weekend, you will not hear from your boy. Emergencies only. All right. Reach out if there is an emergency. Otherwise, all right, D&D is my portion. Have a good weekend, everybody, and we'll talk to you guys.